one of the main reasons we chose to work with our gastric stomach cancer patient communities was because we kept hearing from our communities that many gastric stomach cancer patients were really struggling with nutrition needs first and foremost, I would say, because it's such a difficult, disease to make sure you get adequate nutrition. Also, mental health needs was a big concern. And we felt that speaking directly with this wonderful patient population was so important. And through this study, which was a year-long study, we intentionally met with patients throughout the United States that were not already members of advocacy groups, because we felt that individuals that have already, started working with an advocacy group, they know what to ask for, and they know how to maybe ask for a second opinion or to make sure they get testing and things like that, which is great. And it shows how important our advocacy groups are. But for the patients that maybe are outside of that or aren't aware that advocacy even exists, we thought it was really important to get that perspective from underserved communities. And so again, we went into so many different communities, rural, urban, different populations that maybe aren't necessarily comfortable speaking, with advocacy groups. And we were very fortunate. We worked with medical anthropologists and public health professionals, and went to our communities, listened to their needs, listened to their insights, learned so much in the process. I mean, just incredible amount of information. And then, as you mentioned, we gave them the opportunity that if they had any additional thoughts or questions or comments they wanted to make, that we would schedule individual interviews, after the focus groups. And like you mentioned, 89% of the respondents said, yeah, we would love to do that. So either in person, on the phone, via Zoom, however it worked best for them. We met with individuals and spoke with them on a one-to-one basis. And I think it really gave us so much information, because sometimes people aren't comfortable speaking in front of others, and I get that, and so this really gave them that opportunity to say, this was my situation, or this has been bothering me, or have you thought about trying to work on something like, this? So that's been wonderful. We are keeping in contact with so many of those individuals. And I always say, even if they just get a chance, drop us a text, drop us an email, drop us a quick hello, however they want to do that, just so we know that they're doing okay. And if their needs change, that we can do whatever we can to make sure we get there, and see what we can do together. Our main purpose is just so people don't feel like they're alone. So often individuals don't have caregivers that they can rely on, and some people are alone, they live alone. So it's that's really important to us, just to let them know that we're here and just a phone call away. Unfortunately, the barriers do exist. And again, unfortunately, health equity is something that we all, I know, work so hard to achieve. And it especially, well, I shouldn't say especially, but in our gastric cancer space that we worked so diligently on, for that 12-month research period, we did find that quite a few disparities exist. And I'll use an example again of getting adequate testing. And now that could be biomarker testing, genetic testing, hereditary. I mean, all sorts of different tests that individuals, should have, should be able to access so that they receive the best treatment possible. And I think it's a two-way street, that sometimes patients don't know what to ask for. And sometimes clinicians, I know they're so busy, and I understand, how difficult it can be. And sometimes they maybe don't have the time to explain why some of this testing is so important. So I get it. It's a difficult balance, but what we're hoping to do is that we can level that playing field, and so patients can go into their appointments and say, I'd like this, type of testing. Is it available for me? How can I access it? Are there different screenings that I should be receiving? Just so they feel like they're getting the best care possible. Um, and again, I know we can't solve it overnight, but I think all of us working together, there are ways that we can make it better for our patients, especially those in underserved communities that may be seen in a community setting where doctors just don't have the time. It's no one's fault. It's just so difficult when you see so many patients. Um, and I think patients understand that, but they also feel like, well, we want to be able to get the best care that we possibly can as well. We find, and this across the board, that really our nurses, our nurse practitioners, they're the ones that will say to patients, have you thought about this? Or did the oncologist mention this? And so often then patients call us and they say, my oncology nurse mentioned, XYZ, and we hadn't thought about it or we didn't know about it. So I do have to say, I think it's really, again, our nurses that just always step right up and make sure that patients are being seen and heard and understood, and are really the champions for so many patients that maybe, again, don't have a caregiver with them, or don't feel like, many patients feel like they shouldn't bother the doctor asking questions. And so often I think it's our nurses that say, then I'll ask, I'll find out. And it's great because there's just such partners in care for all of us. And so I guess the only advice I would have for our nurses is that please keep doing what you're doing, because it makes such a difference, and the patients truly appreciate it and receive better care because of that. We are always open to all suggestions. So whether that be from our nurses, our oncologists, our patients, our caregivers, if you feel there are, concerns or support gaps, resources that are not available, we are welcome to suggestions and always want to, meet those needs. So if there's ever any suggestions, we are here and always welcome them. So because that just makes all of us stronger. And I think that our best suggestions always come from our patients, because again, they know what they need. And so our doors open and we're always listening.